The Health Service Executive is the publicly funded healthcare system in Ireland, responsible for the provision of health and personal social services. The climate emergency is a health emergency, and the impacts of climate change are being felt both directly and indirectly on human health. The imperative to protect and improve the health of current and future generations is one of the strongest arguments for action on climate change. Energy-related emissions from the health sector have a significant carbon footprint. Therefore, we have a responsibility and also a legal requirement to reduce the environmental impact of our buildings.
HSE Capital and Estates are responsible for ensuring that our healthcare facilities and buildings are designed, constructed and operated in a way that reduces negative impacts on the environment. The Sustainable Infrastructure Office, which is part of Capital and Estates, has a dedicated team whose focus is on reducing emissions and improving the energy efficiency of the health service buildings. In June 2024, HSE Capital and Estates published the second update of the HSE's Infrastructure Decarbonisation Roadmap. This roadmap outlines the work undertaken to date and our approach to continuing to achieve the targets set out in the Government's Climate Action Plan. The roadmap creates a pathway for the reduction of carbon emissions and energy usage from our buildings and their operation, and shifting the HSE's energy sources from fossil fuels towards renewable and carbon zero ready energy sources. It also includes an approach to and actions required to address EU energy policy and directives. The roadmap forms an integral part of the HSE Capital and Estate strategy and implementation plan in addressing the strategic objective of achieving an estate that is net carbon zero ready by 2050, and it also supports the objectives of the HSE's wider climate action strategy.
Decarbonising healthcare in EU regions is an Interreg Europe project co-funded by the European Union. HSE Capital and Estates are one of 10 organisations from 7 EU countries participating in the project. DAPHNE aims to reduce greenhouse gas emissions, improve energy efficiency policies and implement solutions to reduce carbon in the healthcare sector, along with identifying the latest breakthrough technologies and tools that could accelerate the energy transition in the sector. Through our participation in the DAPHNE project, HSE Capital and Estates aims to share our experiences, work undertaken to date and our approach to decarbonisation in the HSE. We will also benefit through the sharing of technical knowledge from our project partners, along with exposure to technologies and tools that are being used in other EU countries that could assist the Irish Health Service in achieving our energy and carbon reduction targets. Learnings from the DAPHNE project will be incorporated into future updates of the HSE Capital and Estates Infrastructure Decarbonisation Roadmap. As part of the project, we have also established an Irish project stakeholder group with representation from the Department of Health, Capital Infrastructure Unit, the Sustainable Energy Authority of Ireland and third level institutes in order to foster cross-sectoral collaboration and share our learnings from the project with other stakeholders.
By working together to reduce the environmental impact of our buildings and contributing to the well-being of the climate and the environment, we can also improve the well-being of patients and mitigate the health impacts of climate change.